In this section, which is the second section of our lecture, now we will talk about the malignant neoplasm of the nasal cavity. The malignant neoplasm, which we will talk especially in this section, are the carcinoma of nasal cavity and malignant melanoma, and also esthesioneuroblastoma, lymphoma, and haemangiopericytoma. So all these are the malignant neoplasm, and let's start talking about them one by one. First, the malignant neoplasm of the nasal cavity. We have carcinomas, and the carcinomas of the nasal cavity, we have squamous cell carcinoma, and then we have adenocarcinoma. Malignant melanoma, and then esthesioneuroblastoma, lymphomas, haemangiopericytoma, and then solitary plasmacytoma. All these are the malignant neoplasm of the nasal cavity: carcinoma, malignant melanoma, esthesioneuroblastoma, lymphoma, haemangiopericytoma, solitary plasmacytoma, and then we have various types of sarcomas. All these are malignant neoplasm, and if you see this picture as compared to benign neoplasm, which were more localized, smooth, you can see these malignant tumors of the nasal cavity, they are more damaging, they invade the tissues and cause destruction. So this is the picture of malignant neoplasm of the nasal cavity. Carcinoma of the nasal cavity may be extension of maxillary or ethmoid carcinoma. So carcinoma first develop in the maxillary sinus or ethmoid sinus, and then from there it can spread to the nasal cavity. Carcinoma of nasal cavity, we have squamous cell is the most common carcinoma of the nasal cavity, which is about 80% of the carcinomas of nasal cavity are the squamous cell carcinoma. And this we have vestibular, which leads to metastasis to parotid nodes. Septal nose pickers cancer. And then we have lateral wall of the nose is most commonly affected by the squamous carcinoma. So when we talk about the carcinoma of the nasal cavity, the most common is the squamous cell, which is about 80% of the cases. It's the squamous cell carcinoma. There is vestibular, and then we have septal carcinoma is people who have a habit of picking nose. They deal too much handle with the nasal cavity. They are the people who develop this type of carcinoma. And the most common site is the lateral wall of the nasal cavity, the lateral wall of the nasal cavity. Then the other type of carcinoma is adenocarcinoma. So if 80% is squamous carcinoma, only about 20% is adenocarcinoma. And adeno is the term used for the glands. So this is the carcinoma that develop from the mucous membrane of the glands. May mostly involve upper part of the lateral wall. So mainly it involves the upper part of lateral wall. So it's 80% squamous cell, 20% adenocarcinoma. Both are common in the lateral wall of the nasal cavity. Treatment is, as with any cancer or malignancy, is radiotherapy and surgery. Now, next, the malignant melanoma. Malignant melanoma spread by lymphatics and blood. cervical node metastasis, immunological defense play a role. Treatment is by radiotherapy and chemotherapy, wide surgical excision. So this is the malignant melanoma. It spreads by the blood supply and the lymphatic vessels, and the cervical node metastasis, first site of metastasis, or it spread to the cervical lymph nodes present in the neck. Immunity or play an important role. If the immune system of the person is weak, they are more likely to develop the malignant melanoma, and treatment is by radiotherapy, chemotherapy, and by the surgical excision. These are the pictures showing the malignant melanoma. Melanoma is from the pigment producing melanocytes. So usually you see the dark colored tumors, malignant melanoma. Present as salty gray or bluish black mass. Frequent site is anterior part of the nasal septum. Non-pigmented melanotic varieties. So there are a non-pigmented amelanotic variety. So it's amelanotic, which is not producing melanin, which is the pigment producing cells. Color is salty gray or bluish black. All these are important features of malignant melanoma. Next, esthesioneuroblastoma. Esthesioneuroblastoma is vascular tumor, arises from olfactory epithelium. Symptoms: unilateral obstruction, epistaxis, diplopia. Diplopia is the double vision, and epistaxis is bleeding from the nose, and it causes obstruction also. Whenever there is growth or tumor, it causes nasal obstruction, and it arises from olfactory epithelium, which is associated with sense of smell or olfaction. Lymph node metastasis in neck, 10 to 15%, like in the previous tumor also, malignant melanoma, the metastasis is to the cervical lymph nodes. Diagnosis by CT scan, MRI, biopsy. This is the histological appearance, microscopic picture of the tumor, of the tissue removed on biopsy, and this is the picture of the CT and MRI. Treatment is differs from between institution. Treatment differs depending on different institutions. They are mainly craniofacial resection with adjuvant radiotherapy, preoperative radiation followed by craniofacial resection, lateral rhinotomy or midfacial degloving, chemo and radiation followed by craniofacial resection, and en bloc removal of the tumor. So all these are different treatment options for the tumor. Some people think that they should do the resection first, followed by the radiation therapy. The other institutions think that first they should do radiation therapy that can shrink the tumor, and once it is shrink, then they should do the resection. So there are different institutions, different thoughts about the treatment. Then they can do lateral rhinotomy, opening of the lateral sides of the nose, and midfacial degloving, and then chemo and radiation followed by resection. So one is both chemo and radiation before resection, one is only radiation before resection. So these are all the different treatment options depending on different institutions and different ideas or thoughts. Lymphoma and hemangiopericytoma. Lymphomas, rarely non-Hodgkin lymphoma presents on the septum. Hemangiopericytoma, rare tumor of vascular origin. Hemangio is for the hemo is for blood vessels. Hemangio lymphomas are from the lymphatic lymph nodes. So rarely it's rare non-Hodgkin type of lymphoma which develops on the septum. So hemangio. Heme is blood, angio is for blood vessels, so it's the tumor of vascular region from the blood vessels. Arises from pericyte. Peri is around, cyte is the cell, so it's around the cell of the blood vessels. Presents with epistaxis. Whenever the tumors are vascular in origin, they form epistaxis or bleeding from the nose. Biopsy, there is brisk bleeding on biopsy. Benign or malignant, and wide surgical excision and radiotherapy is the treatment of hemangiopericytoma. So it's a vascular tumor, can be benign or malignant, bleed very easily, and wide surgical excision and radiotherapy is the treatment. Plasmacytoma. Plasmacytomas are the solitary tumors. Males are affected more in plasmacytoma. Treatment is radiotherapy followed 3 months later by the surgery. So first radiotherapy that shrink the tumor, reduce the tumor, and then after that surgery is performed. This is the picture of plasmacytoma. Plasma cells are present in plasmacytomas. On long-term follow-up is required. Sarcomas rarely affects nose. This is the picture of sarcoma. Types of sarcomas, we have osteogenic sarcoma, chondrosarcoma, rhabdomyosarcoma, angiosarcoma, and malignant histiocytoma. Again, as the site of origin, the name of the sarcoma follows. Osteogenic is from the bone, chondro is for the cartilage, rhabdomyo is for the muscles, so rhabdomyosarcoma. Angio is from the blood vessels, and histio is for the tissues, so histiocytoma. So all these are the different types of sarcomas that can occur, but they are rare malignant tumors of the nose. They are not as common as other tumors, so sarcomas are rare. So the most common malignant neoplasm so far is the squamous type of the carcinoma, which is 80%, and then 20% is adenocarcinoma. So carcinomas are the common type of malignant tumors of the nasal cavity. So this was all about section 2. Thank you for watching sqadia.com.